the emergency room. I can see by person, by family, who's using the emergency room.
True, but couldn't it be an anomaly of a year? I mean,
no, this is 2 years of data I pulled. When I went back and looked at this. This is 2 years.
And does the data show some are frequent flyers?
Yes.
Oh, I bet.
So it's, okay, so you have, okay.
I have information, again, at this type of a meeting, because you're recording and because
Right,
this is
right, okay.
private information, there's certain things that you just can't discuss. So.
I wonder, like, as an incentive for employees that you had, like right now, if I want to go to the doctor, you know, it might be an hour wait, so you got to take like a half day off at least. So I wonder if we could have some kind of incentive for people to go, where you get more sick days, or maybe you charge people maybe only 2. I don't know. It'd be hard to do charge, but maybe people only for 2 hours of missing school instead of a half day or something like that. So,
Well, you know, in the real world, I was a teacher and I had half the year off. You know, in the corporate world.
You can't assume to be sick only between June and middle
But I
of
mean,
June
if you're
and
that
August.
sick you need to see a doctor, you probably should miss a half a day.
That's right.
But I'm saying for wellness, you just want to see somebody once a year.
I'm going
You
to
know,
summer.
like I get my oil change only in the summer because that's usually when I have the most time. Like, you know, things like that wait till the summer, and so it's not good to wait for your body to the summer. And, you know, you should get things done sooner. But
Again,
you know,
to your
brainstorming.
point, if you're going once a year for a physical, you could do it in the summer if you're off.
Yeah, that's true.
Or Easter vacation.
Or you could take a vacation day or, you know, sick day or, you know, whatever.
Sick.
Oh, sick
If you go to urgent care, though, they consider it emergency care.
It depends on how it's billed. Usually the urgent cares are connected to the hospitals.
Right. Because
Yeah.
every time I've gone to urgent care,
Mhm.
and then I get my bill, and what the insurance pays there, it says, you know, they consider it
Right.
emergency care. And I said, but I didn't go to the hospital, I went to urgent care.
Yeah,
But
but
they're connected with the hospital.
But again, maybe some of those visits are because, to his point, someone doesn't have a relationship with a physician and they're using that instead.
Well,
Yeah.
I personally use it because the hours are convenient, more convenient than seeing my doctor when I needed to see.
But those care centers are more expensive.
Right, I understand that.
Yeah. So just, you know, just this information is back to what we talked about at the beginning about utilizing your plan and what's the smartest way to use your health insurance because it helps all of you. So if you use generic medications when you can, it lowers cost. If you go to the doctor instead of an urgent care emergency room, it lowers cost. If you go to an MRI center that's not at a hospital, that's freestanding, much less expensive, it reduces cost. So then when we have these discussions, we can, you know, keep the health insurance at a low rate so we don't have Cadillac claim taxes, you don't have to pay more money for your health insurance, we don't have to increase deductibles, etc. So that's, you know, about being efficient in how we use it helps maintain your benefit. So that's one of the, you know, that's why we talk about these things, and that's what can you do better? You know, what can you do better as a group to maintain your coverage and
And
keep
it's
your
in
costs
everybody's interest to have that happen.
down? Absolutely.
With some of the other districts that you work with, do they have education programs in place to help people understand, help the employees understand that? Because I'm not sure how well they, as a whole, we understand that.
I was just
Right, I don't think
thinking
anybody
the same
does it well, because, you know, I know we have communicated the, you know, the prescription program and various pieces of the health plan, but unless it's top of mind for you, it's not necessarily gonna happen, and unless it's just like anything else you do, if you're gonna start an exercise program, if you wanna change your diet, you wanna do those things, unless you make it your own habit to do it, it won't happen. So that's one of the